Hi, I'm Maggie. I'm going to be your nurse today. Hand hygiene. I'm going to don clean gloves and close the curtain or door to provide privacy. Can you tell me your name and date of birth, please?
Jackie Smith, May 15, 1999.
Okay, Jackie. So I verify it. Today we're going to be putting in a catheter today, and that's a tube that's going to go into your urethra to extract the urine that you're retaining. So I'm going to lift your gown. I'll be providing another blanket for some more privacy, and then I'm going to ask you to lift your legs up. And then I'm going to clean the perineal area with a cleansing wipe from front to back. And then I'm going to remove my gloves, dispose of them with garbage, and then hand hygiene, don new gloves. I'm going to place my catheter kit in between the patient's legs. I'm going to open the catheter kit. Okay, and then I'm going to remove my gloves, perform hand hygiene. I'm going to remove the sterile gloves. Okay, so I've done my sterile gloves now, and I'm going to remove this drape. I'm just going to ask the patient to please lift your bottom up so that I could place the drape underneath you. And I'm going to place this drape over your perineal area. Okay. And I'm going to set up my catheter kit. So I'm going to remove this. Extract. I'm going to deposit the lubricant into the kit here, and I'm going to put 5 to 7 inches of the catheter tip into the lubricant, and then I'm going to put the saline, not fill out the bubble yet, but just insert it into here, and open my alcohol swabs so that I can clean perineal area again. So now this is going to be my dirty hand. I'm going to clean distally, dispose of it, proximally, dispose of it, and then down the middle. I'm going to then dispose of it. Then I'm going to grab 2 to 3 inches above the from the tip of the catheter and to insert it. So you're just going to feel some pressure, and so just take a deep breath for me, and I'm going to keep going until I feel some resistance. So then once I feel resistance, I'm then going to insert the saline. Okay. And then I'm going to pull back until I feel the resistance of the bubble. Okay, once I do that, I'm then going to then I'm going to attach this to the patient's leg, give her some slack so she can move around, and then I'm going to attach the catheter bag to the bed below the patient's bladder, and then I will dispose of everything that I'm done with. So I would dispose of this in the proper area, remove everything. Make sure this is attached to the bottom of the lower part of the bed so that it's below the patient's bladder. I'm then going to instruct the patient that she can relax her legs, cover her back up. Okay, so I'll be back in a little bit to check on you. Are you comfortable? Can I get you anything?
No, I'm okay right now, thank you.
Okay, and then I'm going to remove my gloves, dispose of them, hand hygiene. and leave.